Many healthcare CEOs are asking themselves, why are our members so upset? What is driving this frustration? A big part of the members' frustration comes from the fact that they're paying premiums and they expect to get the care that they need, and they rely on their doctor to tell them this is the care you need, and then they're told by their health insurance company, no, that's not the care you need. They want to trust their doctor, and their payer is just getting in the way. What can a health insurance company do to address this angst? One element of this is the time it takes from a doctor to ask to the doctor to get the answer. Yes, you're allowed to do this. Another element of that angst is the doctor asks, can I get this care for my patient? The health insurance company says no, the doctor appeals, and then they get a yes answer. That creates a lot of angst. If you can imagine, the patient's perception is, well, why did they say no and then say yes? Are they just trying to stop me from getting care? That's the perception. And so one thing we can do is to help inform the patient and the doctor of what the requirements are, so that we don't get this request, denial, and therefore then an approval later. We can reduce that cycle, because that cycle is a huge driver of frustration. Another driver of frustration, and I've seen this in a relative where they were working with their doctor, and the doctor said, your insurance company doesn't allow that. And this relative did a little bit more research, and it took them a long time to do the research, and they ultimately found that the health insurance company does allow that. But you have to ask the right way, you have to ask with the right justification. And the patient actually has the right justification. It's just that their doctor wasn't aware of what they needed to ask for and how they needed to ask it. So again, informing the patient and the provider very clearly of what's required and how to ask and what to prove will help reduce the number of denials. Because ultimately, there's the denial problem, and then there's the time it takes to get an approval. So if we can reduce the denials by getting the right information up front, we'll ultimately reduce a lot of that angst. How do we reduce the time it takes to get prior authorizations complete? Well, the first step is to reduce the number of prior auths. And that doesn't mean the payer has to eliminate prior auths to start with. They can just tell the provider what needs a prior auth more efficiently, and that will reduce the number that are submitted. We found that number is 30%. So that reduces the number that need to be approved, and that's going to just in and of itself reduce the time and the turnaround time for prior auths. So those are two areas of angst that members have right now: the lack of transparency, turnaround time, and the frustration around denials and ultimately approvals on appeal. That shouldn't be the case, should it? If a prior auth is submitted correctly, there should never be a denial and then later an approval. We should only see approvals or denials. There shouldn't be a secondary cycle. That just says that the problem is broken.